Hi, I'm Dr. Brian Humphreys. Today we'll be talking about middle ear surgery. In particular, the middle ear has a very large part in how well we can hear. The eardrum and the tiny little bones we all know as the hammer, the anvil, and the stirrup are all very important. When these are affected, hearing can be lost. The middle ear is composed of the eardrum, the three little bones, and the space that contains these bones. The inner ear is a different structure that requires a different kind of surgery. Today we'll be talking about surgery involving the eardrum and the three bones. We call this surgery tympanoplasty. The eardrum, in this cutaway view, should be completely intact. The eardrum frequently will contain pressure and keep that pressure inside the middle ear space. If there is a hole on that drum membrane, proper conduction of sound will not occur. The rest of the three little bones also are involved in transmitting that sound to the inner ear, much like a gear linkage on your automobile transmission. If the linkage is interrupted for any reason, proper shifting of gears does not occur. Likewise, if these three little bones are disconnected for any reason, proper conduction of sound will not occur to the inner ear. The eardrum, as seen on this cutaway model, should be completely intact. Occasionally there are things that cause the eardrum to perforate. I've taken care of patients who have had many variations of the cause of perforation. The largest cause is infection. The infection has to be drained out of the middle ear space somehow, and frequently the eardrum will rupture. If you see bloody and pus-filled drainage, this is abnormal. This should be investigated by your physician. Other causes for perforation of the eardrum involve trauma. An open slap to the ear, for example, will frequently send in such pressure to the ear that the eardrum will rupture. Water skiers have a problem with many eardrum ruptures. Divers who go into high pressure zones in deep water will also get into trouble. Many causes of eardrum perforation are self-induced. For example, sticking in a bobby pin or a Q-tip will also cause perforations when you least expect it. When the conduction system is interrupted, when there is a hole in the eardrum or a fracture of the three little bones, proper sound conduction does not occur, and to restore that proper hearing, a surgery must be performed. We call that surgery tympanoplasty. Tympanoplasty is most commonly associated with repair of a perforation. Sometimes a perforation can be easily fixed in the office with simple placement of a patch. A medical-grade superglue is used to apply a small gel film patch onto the ear perforation. In this instance, if this causes and induces healing, the problem is fixed. Occasionally, however, the perforation is too large to be patched. It must be at least under 10% of the eardrum size. The eardrum itself is the size of a dime. Actually, the dime is a little bit larger than the natural human ear. If the surface area that's perforated is 10% or less, there is a good chance that this perforation will heal on its own. However, if the perforation is up to 20% or larger, it is likely not going to heal spontaneously, and surgery to repair the eardrum rupture and perforation may therefore be necessary. In the 21st century, we know that the eardrum is not made of skin. The eardrum is made of a fibrous structure called fascia. Because of that, when we rebuild an eardrum, we will normally borrow fascia from areas behind the ear or in the muscular areas of the scalp. The temporalis muscle in the scalp produces a very equivalent form of fascia that can be harvested and used to rebuild your new eardrum. Frequently, when there have been infections, when there has been injury or trauma, not only is the eardrum broken, but the small little ossicles, the three little bones, are also affected. If there is a problem in the union and linking of these three bones, there will be hearing loss. Because of this, we will frequently also explore the three little bones as long as we have the eardrum under repair. It's a little like looking under the hood when there is an abnormal noise inside your car's motor. When a tympanoplasty is recommended by your physician, this will usually be done in a hospital setting, in a major operating room with a general anesthetic. Fortunately, the procedure can now be done as an outpatient. Tympanoplasty should not be confused with a much larger operation called tympanomastoidectomy. This is a larger operation that involves curing of disease in the mastoid bony area behind the ear itself. The surgery is all done through a microscope with microscopic instruments. It's a bit like building a ship in a bottle. These days, most of the surgeries can be done directly through the ear canal without an incision behind the ear, as was done formerly. When this is possible, your physician will advise you about that surgery. When the fascia is harvested, it is made into a new eardrum-like structure, and this is then grafted. The graft is placed exactly at the phase of the eardrum, and that location is slowly ingrown by the surrounding body's normal cells. A new eardrum thus created is almost indistinguishable from a natural eardrum. The results show excellent improvement in hearing. Hearing losses of up to 30 decibels can be easily corrected by therefore repairing this perforated eardrum and making sure that the little bone connections are all intact. When the bones are not intact, they can be repaired either directly by application of new glues to glue them back together in a proper function, or by replacement with a prosthesis. Modern ear bone prostheses are extremely effective in reducing the hearing loss. After this outpatient surgery has been performed, one enters the healing stage of a tympanoplasty. The healing stage is usually 3 to 4 weeks. At the end of the healing, the graft usually has completely taken, and we can test the hearing once again. We get formal results of what kind of hearing improvement the surgery has produced for you. The risks of the surgery are relatively small. The general risks of anesthetic are well known. In any surgery, bleeding and infection can ensue. Failure to cure and failure to heal the perforation are also possible. The take rate, however, because it is one's own natural tissue, is quite high. The take rate is in the 90s. Nonetheless, failure of the graft can occur. The benefits of the surgery are very obvious. Repair of an abnormal hole in the eardrum is quite obvious. The healing and hearing benefit are quite significant. The 30 decibel air bone gap, or hearing loss, can easily be corrected, and complete restoration of hearing can be completed. Nonetheless, in each individual case, there may not be a 100% cure. Healing is a miracle that sometimes a surgeon takes advantage of, but we cannot always dictate and predict how that miracle will occur. It is my goal to use the technology I know of, the science that I know of, and the medical art to achieve that goal of healing for you.